Good day, everyone. Today, I will be talking about the importance of infection prevention for healthcare workers. This topic is important because infection prevention helps ensure safe and quality care, not only for patients but also for healthcare workers and the community. Infection prevention is one of the basic foundations of healthcare. Without it, even simple tasks or procedures like taking vital signs or giving injections can become dangerous. That is why understanding and practicing infection prevention is essential in every healthcare setting, whether in hospitals, clinics, or community health centers. Healthcare workers are exposed to many germs every day because of close contact with patients. These germs can be found in blood, body fluids, equipment, and even on surfaces that are frequently touched. In healthcare settings, infections can spread easily if proper precautions are not followed. Infection prevention helps protect everyone involved in patient care. It reduces the risk of illness, promotes safety, and supports better health outcomes for both patients and healthcare workers. What is infection prevention? Infection prevention refers to actions and practices used to stop the spread of infections. These practices are applied to all patients, regardless of their diagnosis, and are known as standard precautions. The goal of infection prevention is to break the chain of infection. By doing this, healthcare workers can reduce the risk of transmitting germs from one person to another and help maintain a safe healthcare environment. Examples of infection prevention. There are many ways to prevent infection in healthcare. These include proper hygiene, using personal protective equipment or PPE, cleaning and disinfecting equipment, and proper disposal of medical waste. Although these practices may seem simple, they are very effective when done correctly and consistently. Following these measures every day can greatly reduce the risk of infection in healthcare setting. Why infection prevention is important. Infection prevention is important because it protects healthcare workers from getting sick while doing their job. When healthcare workers are healthy, they can continue to provide quality care to patients. It also protects patients, especially those with weak immune systems, such as the elderly, infants, and those with chronic illnesses. In addition, preventing infections helps reduce hospital stays, medical expenses, and the spread of disease in the community. The first one is hand hygiene. Hand hygiene is the most effective way to prevent infection. Healthcare workers should clean their hands before and after patient contact, after touching bodily fluids, and after touching patient surroundings. Proper hand hygiene helps remove germs that cannot be seen by the eye, whether using soap and water or alcohol based hand rubs. Doing hand hygiene correctly and at the right time greatly reduces the spread of infection. The second one is personal protective equipment or PPE. Personal protective equipment or PPE includes gloves, masks, gowns, and face shields. PPE protects healthcare workers by acting as a barrier between them and harmful germs. Using PPE correctly is very important. This includes knowing when to use it, how to put it on properly, and how to remove and dispose of it safely. Incorrect use of PPE can still lead to infection. The last is cleaning and waste disposal. Proper cleaning and disinfection of equipment and surfaces help remove harmful germs that can cause infection. Items used on patients must be cleaned regularly to prevent cross contamination. Safe disposal of medical waste and sharps, such as needles, is also important. This helps prevent injuries, infections, and the spread of diseases among healthcare workers and patients. Effects of poor infection prevention. When infection prevention is not followed, patients may develop serious infections and complications. This can delay recovery and may even become life threatening. Healthcare workers may also get sick, which can lead to staff shortages and increased workload for others. Poor infection prevention can affect the quality of care and create unsafe healthcare environments. The role of healthcare workers. Healthcare workers play a major role in infection prevention. They are responsible for following infection control policies and practicing safety at all times. By being consistent and responsible, healthcare workers also serve as good examples to colleagues, patients, and students. Infection prevention is a shared responsibility that requires teamwork and commitment. In conclusion, infection prevention is essential in healthcare settings. Simple practices such as hand hygiene, proper use of PPE, and safe cleaning can save lives. By following infection prevention measures, healthcare workers can protect themselves, their patients, and the community. These practices should always be part of daily healthcare routines. Infection prevention is not just a rule, but a responsibility. It requires awareness, discipline, and consistency. By practicing infection prevention every day, healthcare workers help create a safer and healthier environment for everyone. Thank you for listening.